Are there any risks or potential drawbacks to schizophrenia rehabilitation programs? Are there any risks or potential drawbacks to schizophrenia rehabilitation programs? This is an important question for families and individuals navigating the mental health care system. While these programs can provide essential support, they are not without challenges. First, let's consider the type of rehabilitation setting. Inpatient programs offer round-the-clock support in a controlled environment. This can help reduce the risk of relapse. However, these programs often come with high costs that may not be fully covered by insurance. This can create financial strain for families. Additionally, inpatient care limits personal freedom. Patients must follow strict schedules and ranges within the facility. This loss of autonomy can impact motivation and emotional well-being. On the other hand, outpatient programs allow for more freedom. Patients can maintain daily responsibilities like work and family care. However, outpatient care is generally less intensive. This can lead to a higher risk of relapse since patients remain exposed to stressors in their everyday lives. Success in outpatient rehabilitation requires strong personal motivation and adherence to treatment plans. This can be particularly challenging for individuals facing cognitive and social difficulties associated with schizophrenia. Medication non-adherence is another potential drawback. This is a common issue in schizophrenia treatment and can undermine rehabilitation efforts. Missing medication doses increases the risk of relapse and hospitalization. It can also lower overall quality of life. Rehabilitation programs need to address adherence through education and support. Sometimes, this includes combining medication with psychosocial therapies. Patients with schizophrenia often face co-occurring conditions, such as substance abuse or social anxiety. These dual diagnoses can complicate rehabilitation. Programs that do not adequately address these issues may be less effective. This can lead to poorer outcomes, including an increased risk of relapse or social withdrawal. There are also ethical and systemic challenges in balancing risk management and patient autonomy. For example, concerns about relapse and potential aggression can lead to prolonged institutionalization. This may worsen negative symptoms and chronic illness progression if not managed properly. Finally, rehabilitation programs may have side effects related to treatment. Some medications can cause psychiatric side effects, such as delirium or worsening psychosis. It is essential to monitor and adjust treatment to minimize these risks. Families navigating schizophrenia rehabilitation should weigh the benefits of structured support against potential financial costs and loss of independence. Programs that integrate medication management, psychosocial support, and address co-occurring disorders tend to offer better outcomes. However, this requires careful planning tailored to individual needs. Understanding these risks can help families make informed decisions about rehabilitation options.